Good evening, everybody. Welcome aboard. I am Dr. Peter Glidden, your steadfast advocate for health. Very happy to be bringing you a live, worldwide webinar tonight talking about gastroparesis, a much misunderstood condition wreaking havoc with millions of people's lives, while conventional medical doctors are clueless as to the cause and the cure. So happy to be with you tonight. We're going to get started here in a few minutes. We have nearly 2,000 people registered for this event. This is a worldwide free webinar. This webinar is open to everybody and their brother. We do this free education once every month, more or less. I'm happy to do it because where did I read? My people are destroyed by lack of knowledge. I'm Dr. Peter Glidden, your steadfast advocate for health. We will be kicking it off here shortly. Just a few words, a few things you need to know about this event. Just by way of rules and regulations, because it's a free event. Okay, we have people overseeing the chat room. There will be no badgering. There will be no negative talk. We're not going to allow anybody to get out of control or out of hand. You're welcome to express your opinions politely amongst two members of the group, but if you don't keep it polite, then you're going to be extricated from the group. We've only needed to do this a couple of times in the past. You never know who's going to come into the room when you have a worldwide free webinar. So I'm just imploring everybody to keep it respectful, keep it honest. You are, in fact, welcome to your own opinion as long as you are able to stay civil. I look forward to your comments. Now, for those of you who are new to the webinar format, when I give live webinars like this, I myself pay no attention to the chat room. I'm focused on delivering the information. So don't be asking me questions or commenting in the chat room as if you think I'm going to be attending to that question. I will not be. There's a ton of information that I need to put forth tonight. We're going to go over an hour. It's going to be more like 75 minutes. It's going to be more than 60 minutes. There's a ton of stuff I have to communicate here. So feel free to chat amongst yourselves, but just be aware that I'm not going to pay attention to what happens in the chat room during the live health educational webinars. 500 people now in the house. Our record, I believe, is 863. We'll see if we can break this tonight. Canada is well represented here in tonight's webinar, thanks in large part to the work of Mike Phillip, Ashley and Duffy James. Mike Phillip, Ashley, and Duffy James. By the way, Ashley James is expecting her first child any week now. This after she was told for 10 years by conventional medical doctors that it was impossible for her to conceive. This after suffering from chronic fatigue, debilitating chronic fatigue, for years, all of which resolved, and she became pregnant, and she's healthy all the way through the 9th month, thanks to the wonders of science-based, clinically verified medical nutrition. Our thoughts and prayers are with you as you're getting closer to the delivery date. Very exciting what you can do when you give your body its due. I'm Dr. Peter Glidden, your steadfast advocate for health. We will be kicking off our worldwide live webinar on gastroparesis in approximately 5 minutes. I want to give time for new people to find their way here. This video will be archived in my Insider subscription series. It will be posted on YouTube. You will be able to see this for a long time. But I like to give time for new folks to find their way here. I'll be back in just a minute. Chat amongst yourselves. Welcome to my world. Let's kick it off and get started. Welcome aboard, everybody. This is the 5th day of March 2015. Greetings from the great state of Minnesota. I am your steadfast advocate for health, Dr. Peter Glidden. This lecture tonight, Gastroparesis from the naturopathic perspective. Thank you all for finding your way here. By way of perspective, I'm a licensed naturopathic physician. I have 26 years of clinical experience. I'm licensed by the great state of Minnesota to practice naturopathic medicine. I graduated from Bastyr University of Naturopathic Medicine in Seattle in 1991, and I have been in private practice ever since. Naturopathic medical therapeutics are unique in the 21st century. There are less than 4,000 licensed naturopathic physicians in the entire world. Maybe that's incorrect. We might be closer to 5,000 by now. However, of those 4,000 to 5,000, there are less than 200 with more than 20 years of clinical experience, and I am proud to be one of them. The information that you're going to receive tonight is based on over 2 decades of cumulative clinical experience in the pragmatic delivery of science-based, clinically verified naturopathic medical therapeutics, and my lawyers would like it if I say that tonight's information is not meant to replace information delivered to you in a private setting by a licensed and regulated physician. The information that I'm delivering tonight is the same information that I would deliver to anybody who entered my office and secured my services as a patient and was diagnosed with a definitive diagnosis of gastroparesis. So you're going to get the inside scoop of the naturopathic understanding of this, but always understand this as well as many other chronic diseases can be dangerous, and it's never a bad idea to have a licensed, regulated medical professional to help you navigate the territory. And if you decide to get on board with the therapeutics that I recommend, please have a licensed medical practitioner hold your hand through the process and use them to answer questions that you have and to quantify and keep track of your progress or lack thereof. My advice, as always, is to avoid the services of MDs if you're suffering with a chronic health condition. Secure the services of a naturopathic physician and a licensed acupuncturist, a licensed chiropractic physician if you are suffering with a chronic disease. 600 people now in the house. Let's get started. Welcome aboard, everybody. So happy to be with you this evening. Now, I always like to start at the beginning. Starting at the beginning is a good place, don't you think? So, according to WebMD, gastroparesis is a condition in which your stomach cannot empty itself of food in a normal fashion. Now, it's always important to read between the lines. I took this directly off of WebMD this afternoon. I'm not making this up. They say it is caused by damage to the vagus nerve, which regulates the digestive system. A damaged vagus nerve prevents the muscles in the stomach and intestine from functioning, preventing food from moving through the digestive system properly. Well, that makes sense, but then they also go on to say often the cause of gastroparesis is unknown. Well, this is academia, is it not? How can these two things be both true? The cause of gastroparesis is damage to the vagus nerve. The cause of gastroparesis is unknown. It's this type of double talk which is rampant in conventional medicine in the 21st century. What they mean to say here on WebMD, in which their editors somehow dropped the ball on, is that conventional medical doctors, conventional medical science of the 21st century is clueless as to what causes gastroparesis. So sometimes there are things that we know for sure can cause it. For instance, if you have a bullet in your abdomen and it grazed the vagus nerve, well then that could be the cause of gastroparesis, notwithstanding trauma to your central nervous system. The operative cause behind the genesis of this condition is unknown to conventional medical doctors. Let's look at what Wikipedia says. Gastroparesis, delayed gastric emptying, yada, 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 yada. The vagus nerve controls these contractions. Gastroparesis may occur when the vagus nerve is damaged and the muscles of the stomach and the intestines do not function properly. Again, the devil is in the details. Conventional medical doctors, PhDs, medical researchers are completely unaware of the cause of gastroparesis, which should not surprise us because conventional medical doctors don't even know what causes heartburn. If they don't know what causes heartburn, they're unable to cure heartburn, and the cure to heartburn remains elusive. Conventional medical doctors can manage heartburn, but they can't cure it. Conventional medical doctors can manage high blood pressure, but they can't cure it. Conventional medical doctors can manage arthritis, but they can't cure it. Well, it should come as no surprise that conventional medical doctors who hold themselves out as the alpha and the omega of all things medical are clueless as to the generative cause of gastroparesis. On the one hand, well, it might be linked to hormones. On the next hand, oh, it's probably genetic. Oh, no, maybe it's caused by a virus. Oh, no, 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 I know what it is. It's an autoimmune disease. Oh, no, 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 it's related to obesity. Oh, it's related to a negative reaction to prescription medications. Oh, no, 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 it's a diabetic side effect. All of these things have been related historically to the genesis of gastroparesis. But these things are not the cause of gastroparesis, with the possible exception of a negative reaction to a prescription medication, a side effect to a prescription medication. From the holistic point of view that we're going to get into here shortly, all of these conditions are different arms of the same octopus. Diabetes does not cause gastroparesis. Viral infections, autoimmune diseases do not cause gastroparesis. Gastroparesis and so-called autoimmunity and the diabetic condition and blood sugar abnormalities and obesity are all caused by the same thing. They're all arms of the same octopus. But the medical doctors completely got it wrong. It's quite frustrating, actually. And, you know, from the proper perspective, everything makes sense. So it's taking your body suffering from gastroparesis to a medical doctor's office. It is like taking an automobile that doesn't start anymore. You can't start it. Can't start it. Put the key in, turn it, won't start. So you drag the automobile to an automobile mechanic. The automobile mechanic does $5,000 worth of testing and says, you know what? Your car won't start. But they give it a Latin name. Automobilius won't startus. That's what your automobile has. Automobilius won't startus. That'll be $5,000, please. This is what we've gotten used to, regretfully, in the monopolistic world of Machiavellian, mediocre MD therapeutics. Let's take a look at the wonderful world of medicine as it exists now in the 21st century. Medicine is like the field of medicine is like a pizza pie. Nobody owns the field of medicine. Nobody practices medicine. There are different disciplines of medical science, each of which have their own strengths and weaknesses. There's the naturopathic piece. There's the MD piece. By the way, it might interest you to know, if you're a newcomer, that your medical doctor does not practice medicine. They practice allopathic medicine. Nobody practices medicine. Medicine is a vast domain of which there are many pieces, right? There's the chiropractic piece, the traditional Chinese medical piece, acupuncture, Ayurveda, lots of different types of medicine, lots of different medical disciplines. And in the final analysis, if we drill this down a little bit more, all of the different types of medicine fall into two philosophical camps: the holistic camp and the reductionistic camp. Interestingly, the only people in the reductionistic camp are the MDs. And the nurses. Nurses are also trained in reductionism. Every other medical discipline in the world espouses the holistic method. Chiropractic, homeopathy, naturopathic medicine, herbalism, Ayurvedic medicine, traditional Chinese medicine, and acupuncture, etc., 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 all espouse the holistic methodology. And it's important that you understand what the holistic methodology is and what the reductionistic methodology is. Otherwise, you will be suffering needlessly, and you will bring your body to the wrong people. In the reductionistic camp are the MDs. And the nurses. Nurses are also trained in reductionism. Every other medical discipline in the world espouses the holistic method. Chiropractic, homeopathy, naturopathic medicine, herbalism, Ayurvedic medicine, traditional Chinese medicine, and acupuncture, etc., 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 all espouse the holistic methodology. And it's important that you understand what the holistic methodology is and what the reductionistic methodology is. Otherwise, you will be suffering needlessly, and you will bring your body to the wrong medical practitioner. Look, you already know that it's not a good idea to go to a chiropractor if you have a bullet in your arm, right? That's not what they're trained in. Well, we need a little bit more understanding of what the MDs are trained in, how they look at health and disease, and what everybody else is trained in and how they look at health and disease. So your MD might be the nicest person that God ever created, but your medical doctor doesn't know what's best for you. They only know what they've been trained in. And what they've been trained in is one piece of the pie of medical science. It's referred to as allopathic reductionism. And allopathic reductionism argues that the human body is a biochemical bag of parts waiting to break. There is no innate intelligence inside of the body. There is no spiritual force inside the body, no vital force. The body has limited ability to fix itself, and it's the medical doctor's job not to fix the problem but to manage the symptoms. And each part of your body that's problematic gets its own medicine. This is reductionism. Reductionism breaks the body down into its individual pieces and gives one medicine for each piece, right? So one medicine for your heartburn, one medicine for your gastroparesis, one medicine for your high blood pressure, one medicine for your type 2 diabetes, one medicine for your anxiety and panic attacks, one medicine for your restless leg syndrome, one medicine for your asthma, one medicine for your depression, one medicine to take care of the side effects of all those medicines. That's how it is in the wonderful world of allopathic MD-directed reductionism. Now, opposing this, contrary to this, is holistic medical philosophy. And holistic medicine argues that the human body is a system of interrelated parts. It's a self-regulating mechanism, and the system regulates its affairs by virtue of an inborn intelligence, and the inborn intelligence is delivered to the body by the presence of your spirit, your spiritual force. Whatever it is that brings light to your eyes, whatever it is that persists when the body dies, call it what you will, from the holistic point of view, the spiritual force inhabiting the human body is running the show. And the most important aspect of holistic medicine is the fundamental belief, the foundation principle, that the human body knows how to fix itself, the human body wants to fix itself, and the human body is trying all of the time to fix itself. It is the job of the holistic physician to secure therapeutics and deliver them to patients, the intention of which are to support the body's ability to fix itself. Your medical doctor has been trained to simply manage the symptoms of the body because their philosophical orientation does not believe that the human body can in fact fix itself. The argument being, well, if the body could fix itself, it never would have gotten sick in the first place, which quite frankly is juvenile. Now, where the heck did all this start? Well, it started with Sir Isaac Newton and reductionistic physics, right? Sir Isaac Newton, you know, the guy, the apple fell on his head. Yeah, that guy. That's how he discovered gravity. Well, I don't know if that story is true, but nonetheless, physics, as espoused and delineated by Newton, known as Newtonian physics, is all about measuring stuff. You know, you have to measure it. You have to use the scientific method, the double-blinded, placebo-controlled trial, right? You have to measure everything. If it can't be measured, it doesn't exist. Well, since nobody's ever dissected the spirit out of a corpse, since nobody has ever seen the soul with MRI, a CT scan, or an ultrasound, to the reductionistically trained MD, it does not exist. And if it does not exist, well, quite frankly, it doesn't exist. Interestingly enough, reductionism also argues that consciousness itself is a function of biochemistry. And that everything that you think and you feel is simply a biochemical reaction. And when the body dies, everything is gone. It's lights out. There is no life after death. There is no spiritual force. There certainly is no innate, inherent, vital intelligence in the human body. That's all a fiction created by hippies from the 60s. With the MDs, it's all about analytical measurement. Now, you know, my profession, as does every other holistic medical profession, is of the opinion that science is a good thing and that the scientific method is a good thing. However, the scientific method must be whole and complete. Otherwise, you will miss things that are right in front of your face. For instance, if you knew nothing about gravity, if you knew nothing about the size of the planets and the sun, you could go outside every day for 1 year and you could measure the position of the sun in the sky at different parts of the year. And you could collect massive amounts of data, and this massive amount of data would then enable you to stand up in front of your scientific peers and say, guess what? I've done all of these measurements and I have concluded that the sun goes around the earth. But because you left out a few data points, because you did not know about gravity and the mass of the earth and the mass of the planets and the mass of the sun, your observations supported by mountains of data would be incorrect. The earth, the sun does not go around the earth. The earth and all of the other planets go around the sun. But if you had limited data, you would come to the wrong determinations. And this is what happens when you bring a reductionistic methodology to bear on a living, breathing, holistic system such as the human body. For goodness sake, this is why MD-directed medical therapeutics for chronic diseases don't work, because they're based on an old-fashioned, outdated philosophy of healing, quite frankly, which has its strengths, but while we've been under the care of reductionistically trained MDs, there are currently 5 million people in the United States suffering with gastroparesis. 5 million people. The MDs have dropped the ball on this, the same way that they have with Alzheimer's and autism and high blood pressure and heart disease and cancer. I mean, this is not a condemnation of the profession. It's just a laying bare of the facts. 5 million people in the U.S. have gastroparesis while we've been under the care of the MDs. Let's put that in perspective. Multiple sclerosis, 350,000. Amyotrophic lateral sclerosis, 30,000 people. 5 million with gastroparesis. You got to be kidding me. This underlines, better than most things, the abject failure of conventional medicine. I mean, the MDs are in charge, and while they've been in charge, everybody's sick. And yet we've been so socialized to believe that the MDs own medicine and that everybody else is a back-of-the-bus quack, that when the MDs let us down, and they let us down hard, we give them a pass. What's the best place to hide something in plain sight? What's the most expensive medicine? The one that doesn't work. Look, if you took a Chihuahua duck hunting, I'm pretty sure you'd come back empty-handed. That's the wrong dog for the hunt. You need the right medical profession for the right condition. Again, you wouldn't go to a chiropractor if you had a bullet in your arm. Well, if you knew any better, you wouldn't bring your body suffering with gastroparesis to an allopathically trained MD. They're the wrong dog for that hunt. Completely the wrong dog for the hunt, as is evidenced by the facts. Again, you're welcome to your own opinion, but not your own facts. Now, what all of this means is that MD-directed treatments for chronic diseases don't work. They don't. Gee, Dr. Glidden, will an apple a day really keep the doctor away? Well, if your aim is good. Right? I mean, we need a little levity here. We're suffering needlessly. We're dying. You know what a big bad voodoo daddy gastroparesis is? It's flippin' horrible. Now, before we get into the meat and potatoes of, what we're going to do for this, we got to give the devil his due. Remember, there are different types of medicine, and they all have strengths and weaknesses, right? The strengths of the allopathically trained MD is surgery when it's absolutely necessary, trauma care, and a handful of infectious diseases. In these areas, the MDs excel. They're brilliant. The stuff that they can do with surgery now is just this side of miraculous, as far as I'm concerned. Thank God for Novocaine. Thank God for penicillin. Thank God for morphine, the sterile technique, and the mattress stitch. And if heaven forbid, I have a triple compound fracture of my femur, an arrow sticking in my leg, a bullet in my arm, take me to the MD, because that's their strength. Chronic disease is not their wheelhouse. Gastroparesis is not their wheelhouse. Completely the wrong dog for the hunt. And yet, because we don't have a free medical market, we don't. Because the MDs own the show. Because the only medicine that your insurance pays for, MD-directed medicine. Because the only medicine that you're aware of is MD-directed medicine. Because the only medicine that's practiced in your hospital is MD-directed medicine. And the only medicine that they make TV shows about, MD-directed medicine. When you're sick and suffering, where do you go? Do you go to the unknown factor? Do you go to the naturopath? No, you go to the MD. And this is the problem that I have with the profession. If we had a free medical market, I would have no problem. And if we had a free medical market, all of this nonsense would have been sorted out years ago. Because in a free, open system with equal access to everybody, people who are sick gravitate to the therapy that works. The only people keep going back, the reason that people keep going back to the MDs with chronic disease is because they don't know any better, and the MDs have told you that I'm a quack. Quite frankly, it's nonsense. But remember, we need the right perspective. We need the right dog for the hunt. And when it comes to chronic disease, the right dog is the naturopathic dog. So let's talk about it. Let's get into the meat and potatoes, shall we? The holistic understanding of gastroparesis. Now, again, I like to start at the beginning. So here's your digestive tract in full orange color. There's your liver. There's your stomach. There it is, right there. There's your stomach. There's your small intestine. There's your colon. And that's how it goes, right? You swallow food, it goes into the stomach, and then from the stomach into the small intestine, and then from the small intestine into the colon, and then you poop it out. And that's the digestive tract from start to finish. With gastroparesis, we're specifically focused on the stomach, which in the final analysis is a great big bag filled with acid. Now, if your stomach was healthy, 100% optimized, 100% healthy, the acid in your stomach would be so strong that if you cut your finger off and swallowed it, it would be digested down to the bone, just from the acid in the stomach. In a perfect world, your stomach is a great big bag of acid, and what happens? Well, you chew food up and you swallow it, it drops into the acid bath, then it gets dissolved in the acid bath into a liquid form, and then that liquid stuff gets squirted out of the stomach and goes into the small intestine. And it's the small intestine's job to absorb whatever the stomach just digested, absorb it into the bloodstream, and then the large intestine's job is to get rid of it. What you weren't able to absorb, all the waste products that your body couldn't absorb. The stomach's job is to digest things chemically into a liquid form. When you have gastroparesis, for some reason, this step in the dominoes of digestion is interrupted. For some reason that medical science is completely unaware of, your stomach does not squirt out the stuff that it just digested. Now, this is the nuts and bolts of gastroparesis. And by the way, gastroparesis is fancy schmancy doctor talk for paralysis of the stomach. That's what it means, literally in Latin. Gastro, stomach, paresis, paralysis. The stomach doesn't squirt the food out after it's been digested. Now, this is a problem. Well, why is it a problem? Because the human digestive tract, the human system, everything's connected, baby. The hip bone's connected to the thigh bone, right? It's all connected. And it's like a giant system of interlocking gears. And when you throw a cog into one aspect of those gears, it's going to have a ripple effect across the entire system. So what happens? You get all kinds of symptoms. You get nausea, you get heartburn, you throw up, the leaf falls off of a tree and you throw up. You've got pain, It's not good. You can't digest. You can't eat anything. You start to waste away. And then you become undernutrified, and then you need a feeding tube. And meanwhile, you're still in a world of hurt. Why? Because it is an interconnected, beautiful system of interrelated parts. And when you screw up one of those parts, well, pretty sure that's also the cause of zombie brides. All right, all right. Zombie brides have nothing to do with it. But when you mess up a piece of the system, it has a ripple effect everywhere else. A ripple effect everywhere else. And this is an important consideration to understand. Because naturopathic medicine, which I'm trained and licensed and regulated in, argues one of the first fundamental precepts of naturopathic medicine is you treat the person, not the disease. You support the body in its ability to optimize its structure and function, because the holistic philosophy argues that your stomach is trying to digest food properly right now. It wants to do it. It has the ability to do it. It's trying to do it. And it's the holistic physician's job to support that process in whatever means they're trained in. So, when we're talking about the holistic intervention, the holistic therapeutic for people who have been diagnosed with gastroparesis, we give general overall nutritional support for the entire body and extra stuff specifically targeted for the digestive tract, which we will enumerate in just a moment. Now, look, if you're suffering with gastroparesis, you don't need to know this. You could write a book on this, and it's a lot more than this. But these are some of the things that come along for the ride if you've been diagnosed with gastroparesis. You got heartburn. You got pain. It's not fun. Gastroesophageal reflux disease. Nausea. You're throwing up all the time. You feel full. You eat an almond and you're full. You're starving. You eat an almond and you can't eat anymore. Your abdomen bloats. You look like you're 3, 4, 5, 6 months pregnant. Can't eat because when you eat it hurts. Then you start wasting away and you need a feeding tube. And then everything else starts going to you-know-where in a handbasket. It's a problem. And again, I cannot emphasize enough. While we have given complete control of the medical marketplace to the allopathically trained, reductionistically oriented MDs, 5 million people in the U.S. are suffering every year with this unbelievably burdensome illness. And why isn't there a congressional hearing? Why aren't people marching on Washington, D.C.? The MDs are horrible. They've let us down. Why on earth am I paying hard-earned money out of my pocket for medical insurance premiums to gain access to this type of nonsense? They are clueless about what to do to help me. I demand an investigation. I'll tell you why. Because we're all embedded in the matrix of the MD. We all think that the MD has some secret decoder ring to the secrets of the universe. And if the MD can't figure it out, then nobody can. And so even though their therapeutics fail us, even though their therapeutics harm us, even though their therapeutics bankrupt us and kill us, we continue to go back to them because we do not know any better. Well, perhaps this would be a good time to iterate how sophisticated, intelligent physicians understand and treat gastroparesis. Need to start at the foundation. Need to start at the beginning. Foundation of holistic medicine argues that the human body is endowed with a spiritual force. This is not a religious conversation. This is not a religious conversation. It's a spiritual conversation. There's an energy inside the body which caused your body to grow itself all by itself from a tiny single cell into you. Amazing stuff. All by itself, this happened. All by itself, your body did that. Now, do you think if your body could do that all by itself, it knows how to fix itself? You're darn right it does. And again, this is not a religious conversation. I don't care if you're a Buddhist, a Hindu, a Jew, a Christian, doesn't matter. If you're religious, you argue that there isn't such a thing as a spirit. Well, guess what? Holistic medicine argues that it is the presence, that your body is imbued and endowed with an intelligence. It's running the show, and that intelligence is brought to your body by the presence of your spirit or your soul, period. Now, what does this mean therapeutically? Does this mean we're all going to get together and sing Kumbaya and lay hands on people and chant, mystic chants to cure somebody? No, that's nonsense. What this means is of fundamental importance, and it is completely overlooked. It is completely overlooked in the 21st century. Your body knows how to fix itself. Your body wants to fix itself. Your body is attempting all of the flipping time to fix itself. It's your birthright to be healthy. And the majority of chronic diseases, are rooted in nutrient deficiencies. Your body has run out of the stuff it needs to optimize its structure and function. And because your medical doctor has no training in medical nutrition, they are blind to this fact. And therefore, you suffer needlessly. Now, I've been practicing naturopathic medicine for 26 years now. 26 years. Where does the time go? I know, I don't look that old. And in my 26 years of clinical experience, I got remarkable results. But since I've met Dr. Joel Wallach, the founder of YGYOntario, the things that I've seen people recover from while I've been following Dr. Wallach's advice, leaning on Dr. Wallach's research, leaning on Dr. Wallach's understanding of pathophysiology, and applying Dr. Wallach's therapeutics, the things that I've seen people recover from following Dr. Wallach's methods eclipse anything that I'd previously seen. Dr. Wallach deserves a Congressional Medal of Honor for the information that he's brought to the public table regarding the pathoneogenesis of chronic disease and what to do about it. Now, by the way, in full disclosure, Dr. Wallach's company, YGYOntario, I'm a giant cheerleader of. I am a giant cheerleader of YGYOntario. I think it's an awesome company. I think their supplements are awesome. I think everybody in the world should take them. And I am not a YGYOntario representative. I get zero money, zero. I get nothing from the sale of YGYOntario supplements. So if there are naysayers in the crowd saying, oh, here it comes, Dr. Glidden's just trying to make a buck selling a YGYOntario nutritional supplement, selling a vitamin to me, you're wrong. Because I don't make a red cent from it. Zero. I'd love to, quite frankly, make money from the sale of YGYOntario supplements. But I am prohibited by law from doing so. And that's a crying shame. In any event, my advice, based on 26 years of clinical experience, is if you have the option of listening to Dr. Wallach or listening to anybody else tell you what to do to get on the other side of a chronic disease, listen to Dr. Wallach. Dr. Wallach was in charge of $25 million of federally funded research. $25 million of federally funded research from 71 to 1983. Wallach did 26,000 autopsies, 10 million blood chemistries and histopathologies, which resulted in the publication of this book, which is in the Smithsonian Institution in the United States. It's a national treasure. It rewrote our understanding of the relationship between nutrition and chronic disease. People say, oh, those naturopaths, they don't practice science-based medicine. All their stuff is just imagination. Guess what? That's a load of crap. Science-based, clinically verified. Science-based, clinically verified. Science-based, clinically verified. That's what we do. And if you can't wrap your head around that, well, I'm happy to refer you to an MD. Now, $25 million of federally funded research, 26,000 autopsies, and 10 million blood chemistries and histopathologies brought us to understand many fundamental concepts of holistic health. The biggest one, the single most important thing for you to understand. If you never remember anything else that I tell you, remember this. Brought to you by $25 million of federally funded research. In order for the human body to work the way that nature and God intended, if you're an atheist, I cannot help you. In order for the body to work the way that nature and God intended, it needs 60 minerals, 16 vitamins, 12 amino acids, and 2 essential fatty acids to go down the hatch every day. That's 90 essential nutrients. A nutrient is termed essential if you need it, but you'll die without it. 90 essential nutrients. And this is why in the Longevity Company, remember that I'm a cheerleader of, you'll often see the slogan 90 for life, and that's what this refers to, the 90 essential nutrients necessary for life. The only problem with this concept is it is impossible for you to secure all 90 essential nutrients from food. You can't do it. It's not just tricky, it's not just improbable, it's impossible. You cannot do it, and here's why. Do the math. The lion's share of your essential nutrient needs are the minerals, right? 2/3, that's 66%. 60 out of 90, that's a lot. Things like calcium, sulfur, zinc, selenium, iron. Only problem with minerals is the only person that can make minerals is God. Animals cannot make minerals. Plants cannot make minerals. Right? I mean, look, if a plant could make a mineral, we could bioengineer lettuce to make gold. We'd all be rich. The only place that minerals are found is in the soil. Sometimes they're in the water, but if they're in the water, it's because they washed there out of the soil. Only problem with minerals in the soil is they're not evenly distributed in the soil. Here's a map of one mineral, selenium. Extremely important for health. Extremely important for health. Selenium supplementation reduces the occurrence of breast cancer by 82%. 82%. 200 micrograms of selenium taken every day prevent breast cancer by 82%. Now, why doesn't your medical doctor tell you that? Inquiring minds want to know. Here's a map of selenium deposition in the United States in the topsoil. On this map, if it's reddish, orangish, there's a lot of selenium. Green is a little bit, gray, a lot less, and white there isn't any. So, if you're eating Brazil nuts grown in soil in one of the areas that there's no selenium in the Brazil nut. Because the only place that plants get minerals is from the soil. The only place that animals get minerals is from eating plants. Period. So let's look at it this way. If this represents your body's nutritional needs, in order for your stomach and your lungs and your heart and your kidneys and your liver and your spleen and your brain and your blood vessels and everything else to work optimally the way that it's attempting and trying to do right now, your tank needs to be topped off every day with 90 essential nutrients, period. But because it's impossible to secure all of these nutrients from food, most people's tank is less than halfway full. Oh, you don't take the supplements, your MD will tell you, they just give you expensive urine. Baloney. Quite frankly, why would people listen to somebody who has had no training, no experience, no respect, and no appreciation for medical nutrition to tell them about vitamins? I mean, we don't go to chiropractors to learn about the newest surgical technique. We don't go to chiropractors to learn about drugs. By the way, I love chiropractors. Chiropractors have saved my life. Chiropractic medicine is awesome. I refer people to chiropractors all of the flippin' time. I love chiropractors. But we're not going to go to a chiropractor to get advice on drugs. Well, why would you go to an MD for advice on vitamins? I don't know. Well, quite frankly, I do know. We're all embedded in the matrix. We all believe in the myth of the MD. And it's a problem. It's a problem. So, you need 90 essential nutrients. You can't get them all from food. You got about, maybe if you're lucky, you have half, probably not, and then you experience the stress of life. Stress of life burns through your nutrients. Now you're running on fumes, and now things break. For goodness sake. Gastroparesis, your stomach breaks. Why does your stomach break? Because it ran out of the stuff it needed to fix itself. For goodness sake, if your car runs out of oil, you know, do you think that it must have been the welds? It must have been bad metal in the engine? It must have been the spark plugs? It must have been the battery? It must have been the wires? No, it ran out of oil. Well, your body's no different. When your body runs out of the essential nutrients that it needs to run properly, things start to break. And when things start to break, things are broken. Now, the fundamental intervention here for everybody across the board is fill the tank back up. Wouldn't that be a smart thing to do? Wouldn't that be a good place to start? Wouldn't that be a good idea to give the body a fighting chance? That's what we do. And that's why this webinar is important. Because there's another myth that we're suffering from. The belief that when you're dealing with a chronic disease, you have to have a private appointment with a physician. You do not. When you're dealing with a chronic disease, the first, second, and third thing you should do is give your body nutritional support. Give your body nutritional support. Give your body nutritional support. Keep your fingers crossed and see how far back your body is able to bounce on its own accord. This is our method. This is our mission. This is our mantra. 90 for life. So here's the recommendation. Specific recommendations for what you should do right now if you're laboring beneath the wheel of a diagnosis of gastroparesis. You have to stop eating these foods. Now, I've done an entire 45-minute webinar that explains why. And if you go to my website, drglidden.com, and sign up for my free newsletter, it's free. Do you like free? Is free good? When's the last time an MD gave you anything free? Oh, I remember. It was a free sample of a prescription medication that then you're going to have to pay for later. Isn't that what street drug dealers do? Hey, kid, come over here. The first one's free. You're going to love it. Go to my website, sign up for my free newsletter, and you will automatically be given a video which explains why these foods are bad. You must stop eating these foods. They will hurt you. Number 1, eliminate the 10 bad foods. Number 2, fill up the tank. Now, another concept of holistic medicine is that healing is possible, and healing is a process. It is not an event, right? We go to a MD and they deliver a medicine which does not cure the disease but which manages the disease, but it works almost immediately. You take the Advil and in 10 minutes the pain's gone. Whoa, that's great. You take the Pepsid AC and 30 minutes later the heartburn's gone. Gee, that's great. Well, that's like painting over the mold in the basement, right? Still there, you just don't see it anymore. Healing anything with a holistic method is a process, not an event. It plays out over time. You can't force the fruit. So, generally speaking, if people are suffering with a chronic disease, and I don't care what it is, the recommendation is eliminate the 10 bad foods and give your body nutritional support for 90 days. And inside that 3-month time period, pay attention to how you feel. Because remember, everything's connected. So once a properly applied holistic medical therapeutic starts to take hold, we anticipate and expect across-the-board improvement. Digestion gets better, pain gets better, gas gets better, nausea and vomiting gets better, sleep gets better, energy gets better, appetite gets better, sex drive gets better, physical temperature gets better. Why? Because everything's connected, and it's the first flippin' time in your life your body has had all the nutrition that it needs to fix itself. So this is a 3-month program. If you're looking for a quick fix, look somewhere else. It does not work that way, regretfully. So here's the 3-month program. Per month, I want you to get 1 Healthy Body Start Pack 2.0 liquid, 1 bottle of Ultimate Plant-Derived Minerals, 2 bottles of Ultimate Enzymes, 2 bottles of Ultimate Selenium, 2 bottles of Mackey Plus. And that's what I want you to get every month, and 1 Super Life Cal Toddy. Here's where I want you to go to get it. These are all longevity products. I do not make 1 red cent from the sale of these nutritional supplements. The website that's referenced there and that 800 number that's referenced there belongs to a group of longevity distributors who have spent a lot of money to get this information to you right now. You think free stuff is really free? Well, guess what? It's not. We live in a world of commerce. It took a lot of money to be able to generate this webinar. And so, my recommendation, go here to get your supplements ordered and delivered and taken care of. And if you go here, you'll also be able to get support from the people that you're placing the order with. Because we are in the process of generating a grassroots coalition of the informed. Now, if you were introduced to this webinar by somebody who was already a longevity member, then go to them to get the order fulfilled. Lean on the people who brought you to this webinar. And if you found us on Facebook, if you found us because an angel of the Lord appeared to you in a dream last night and said, you got to watch Dr. Glidden's webinar, then call that number. Again, full disclosure, Dr. Glidden makes zero from the sale of longevity nutritional supplements, or quite frankly, any nutritional supplements. I recommend longevity because they work better than anything I've ever seen. And I am 100% behind the mission of longevity, which is to bring this message of health recovery to as many people as is possible by generating a grassroots coalition of the informed. Why? Because we don't have a free medical market. Your medical professional does not know what we know. We are kept way off of the bus of medicine, and the only way you're going to have access to this information is if somebody taps you on the shoulder and says, hey, guess what? I know a doctor who says you don't have to suffer with that. Check out this webinar. You want to get involved with that movement? Become a longevity member right now. Now, here's how to take it. Now, if you were to come to me for a private, I don't even want to tell you how much it costs to see me in private practice. It's a lot. I'm giving this to you for free. Here's how to take it. One Healthy Body Start Pack 2.0 liquid. In that package, there are 3 products. Beyond Tangy Tangerine 2.0. I want you to put 1 level scoop in 12 ounces of water and drink it down. I want you to do that twice daily. I want you to take at least 2 hours to drink each dose down. If you're on a feeding tube, do the same thing. Put it in the feeding tube twice a day. The same dilution. 1 level scoop in 12 ounces of water twice daily. Don't just pour it into the feeding tube. A little bit at a time, a little bit at a time, a little bit at a time, a little bit at a time. Essential fatty acids is another component of the Healthy Body Start Pack. You need 1 capsule 3 times a day with food. 1 capsule 3 times a day with food. If you're on a feeding tube, I want you to pierce the little gelatin capsule with a sterile needle. Squeeze the oil out onto a piece of gluten-free bread and a little piece of gluten-free bread or a little piece of fruit and put that into the feeding tube. Mix it into the stuff that you put in the feeding tube. Pierce the capsule with a pin to get it down. Beyond OsteoFX is a liquid calcium supplement. Now, calcium is of major importance in the health of your stomach. Calcium is of major importance in the health of your stomach, and I'm going to tell you why shortly. Beyond OsteoFX is arguably the best, most absorbable, most effective calcium supplement I have seen in 26 years of clinical work. 1 ounce mixed with 1 ounce of orange juice or 1 ounce of water. If you have a blood sugar issue, don't use orange juice. In the morning before breakfast or in the feeding tube. Plant-derived minerals. It's a liquid supplement. I want you to mix 1/2 ounce of it with each dose of the Beyond Tangy Tangerine. 1/2 ounce of the plant-derived minerals with each dose of Beyond Tangy Tangerine. The enzymes. 2 capsules 5, 10, 15 minutes before you eat something or at the very beginning of the meal. And if you're doing a feeding tube, I want you just to throw the capsules into the feeding tube the same way, 5, 10, 15 minutes before you start to eat. Selenium, 2 capsules 3 times a day between meals. 2 caps 3 times a day between meals. And the Mackey Plus, 1 ounce plus 2 ounces of water twice a day between meals. 1 ounce plus 2 ounces of water twice a day between meals. Cal Toddy, last but not least, I want you to take 1 ounce of that and mix it with 1 ounce of orange juice or water immediately before bed. Immediately before bed. The only reason you wouldn't use orange juice is if you had a blood sugar issue. Now, we're also going to bring homeopathy to play here, and I've done a webinar on homeopathy that I'm going to want you to watch, which will explain the rationale behind what I'm about to tell you. Now, homeopathic medicine is not prescribed for the condition. Homeopathic medicine is prescribed for the symptoms. Since there are millions of people literally suffering with gastroparesis and only a handful of licensed regulated homeopathic physicians in the world, it would be a good idea for me to go out on a limb here and say there are 2 homeopathic medicines which you can try to see whether or not they will help you. They cannot hurt you. They're going to cost $10, $15, depending on shipping. If you follow my instructions here, the worst possible thing that can happen is the homeopathic medicine will do nothing. It will fail you. But remember, we don't prescribe homeopathy based on the diagnosis. It's on the symptoms. So here are the symptoms that point towards the use of homeopathic lycopodium. You're hungry. You want to eat. You eat a couple of mouthfuls of food and you're full. If that happens to you, you're probably going to benefit from a dose or two of homeopathic lycopodium. You have aching pressure in the right side of your abdomen, mostly the right side of your abdomen. You feel like crap every day between 4 p.m. and 8 p.m. You just go downhill, and you go downhill fast, and then after 8 o'clock at night you rally. By the way, that's standard time, not daylight savings time. And there's lots of gas and distension in the abdomen with rumbling. If more than 2 of these symptoms describe your experience of gastroparesis, then you should give homeopathic lycopodium clavatum a try. Another homeopathic medicine to consider is called ipecacuanha. Ipecacuanha. The indications for the administration, the use of this homeopathic medicine, are constant nausea with or without vomiting. You feel like you're going to throw up all of the time. You're pale and you're cold, especially when you throw up. Your nausea gets worse when you lie down. It's better if you're sitting up or standing up. And when you're nauseous, it's accompanied, or when you're throwing up, there's lots of clear saliva. If these symptoms paint a picture of you closely, give homeopathic ipecac a try, and here's how you take it. Now, again, I mean, you can read it, but this information is offered to you for free because there's only one of me, and there are millions of people suffering from gastroparesis. And contrary to popular belief, homeopathic medicine is not a placebo. Contrary to popular belief, if you follow these recommendations, it is impossible for you to hurt yourself with the use of a homeopathic medicine. It's always a good idea to secure the services of a licensed, regulated homeopathic physician in order to help you navigate this territory, but you're probably not going to be able to find that, so have at it. Quite frankly, folks, you've been let down, and you've been let down hard, because of a lack of knowledge and the monopolization of the medical marketplace for the last 100 years. If you were to see me as a patient in a private practice and you had gastroparesis, I would tell you to do exactly what I just told you to do. Remember, it's always a good idea to secure the services of a licensed naturopathic physician to help hold your hand and guide you through this territory. And if you can't, then the second best thing is to follow the advice laid out here. That's what homeopathic medicines look like, little tiny white pellets dispensed in small vials. There are 2 websites you can go to get access to homeopathic medicines via the mail. Again, I'm not affiliated with either of those companies. I make no money from either of them. I get no advertising money, no nothing. Those are companies that I like, that I've leaned on for 26 years. I appreciate what they're up to, so I will support them. By the way, if you're a subscriber, you also have access to weekly live chats. There are hundreds of people who are in a chat room with yours truly asking questions, and I'm answering the questions. There's also a forum where you can go and type in a question and find out what my answer has been when other people have asked the same question. This is a remarkable tool that you can use right now to support your body's God-given ability to fix itself. And this is our fundamental message. Your body knows how to fix itself. Your body wants to fix itself. And most of the time, the only reason that it's struggling is because it's run out of the raw materials that it needs to do that. It needs a little help. Thanks for your time. I appreciate it more than you know. Until we meet in person, I remain your steadfast advocate for health, Dr. Peter Glidden. Thanks again for your time.
And definitely check out my book, Fake Diseases. It covers all of the major topics that come up, like birth defects, blood sugar problems, bone and joint problems, cancer, autoimmune problems, and more. And it's on Amazon for just $9.99. And the audiobook read-along version is free here on YouTube, and the link for that is in the description of this video. Definitely get yourself a copy of Dr. Wallach's cookbook. This is basically a textbook teaching you everything you know about how to cook without the bad foods, particularly oil and gluten, and all of the other problematic things on the list. This is 300 pages stuffed full of recipes, every traditional recipe that you could think of, and modern dishes without the bad foods that they're usually made from. And of course, make sure to check out our food page, Notus Foods, that's on YouTube, and at Notus Foods on Instagram. We have a lot of content up there teaching you how to cook without the bad foods that Dr. Wallach describes, and Dr. Glidden's 12 bad foods, all of that, all of the rules that you need to know. And we have experienced chefs and bakers who will answer the questions in those inboxes. And I've also published a book in response to some of Dr. Wallach's criticisms, including the major articles that have been written against him on the internet. So if you are a Dr. Wallach fan or a longevity distributor, I definitely recommend having this book in your toolkit.